Hello, my name is Dr. Christopher Hartnick. I'm the Director of Pediatric Otolaryngology here at Mass Eye and Ear Infirmary in Boston, and I'm also the primary investigator for the hypoglossal nerve implant study for children with Down syndrome. That's an FDA-approved study that's happening both here in Boston and now at several sites across the country. And this video itself is for you as parents to help you understand what the procedure is itself, what your child will be or would be undergoing from the point before the surgery, during the surgery, and for the full year of the study after the surgery, to talk you through what the risks and the benefits of the surgery are, what the general outline of the surgery are, and to give you information in terms of how you can get more resources to gain more knowledge about this, both by reading materials as well as by talking to other parents to gain their information about the study as well. So for you parents, just as at a mile-high view, what is this procedure, right? This procedure is a procedure to help your child not have sleep apnea anymore. And for children with Down syndrome, if your child passes the inclusion and exclusion criteria, the thought is that the majority of the reason for the sleep apnea is because your child, when they're going to sleep at night, their tongue, which is relatively large in the back of their throat, is falling back into their airway and obstructing. So they're trying to take a breath, but when you see your child heaving to try to take a breath, it's the tongue that is causing the issue. And the device itself, think of it like a pacemaker. It has a sensor which is underneath the skin. You will never see it. That senses when your child is at night trying to draw a breath. It then sends a signal to another processor, which again is underneath the skin. You'll never see it. Maybe you feel a slight prominence, but you'll never see it. That processor then says your child is trying to take a breath, and it's going to send another signal up to another wire that's under the skin. Once again, you'll not see it, that goes to the nerve that moves your tongue forward. And the nerve that moves the tongue, think of your tongue as a marionette. There are different branches. Part of the branches of the nerve move your tongue forward. Part of the branches of the nerve move your tongue from side to side. Part of the branches of the nerve move your tongue back. The key to this surgery is that we're isolating only those branches of the nerve that move your tongue forward, putting a cuff around that so that when your child's breathing at night and struggling to breathe, the machine senses it and sends a signal to your child's tongue to move forward and unobstruct the airway so they no longer have sleep apnea. So what I'm going to talk to you now about are the inclusion and the exclusion criteria for the study itself. How do we know if your child would be an appropriate child for this study such that we could say with credible thought that your child will actually no longer have sleep apnea? And what are the risks and what are the benefits of the study itself? Once your child has met the eligibility criteria, and you've either spoken to myself or to whomever the surgeon is at one of the sites that are performing this surgery as part of the trial, it's important to know that there's now a block of time that we're going to have to go through the pre-cert process in order to get the surgery itself approved from the hospital itself. And this can be frustrating for the doctors and the parents alike, and it means teamwork. It means working with the pre-cert offices at Inspire and at the hospital, and we all work together for this. And often, initially, this surgery may be denied, and it may take a couple months to get to from the time of your child meets criteria to your child has surgery. So be patient with the process and work with your surgeon on that. Once you've gone through that process, then the date has to be chosen. And for each one of these cases, we fly in nerve monitoring specialists along with the surgeons itself. So we curate and choose that date carefully so that a whole team is there on that given day to help your particular child. So it's important to know this for your child. This is not just the day of surgery. It's simply an implant. This is a 1 year and longer than that relationship that we're going to have together between you, your child, and your surgeon and your team. that on the day of surgery, when the device is implanted, it is not turned on that day. It is then kept off for a full month until it heals in nicely. And at the time, then there's going to be a sleep study at the 1 month mark, 2 month mark, 6 month marks, and 1 year mark to really fully titrate that device so that it's working best for your particular child. The goal at the 1 month mark is not to cure sleep apnea, it's just to get the device turned on, make sure it's safe, make sure you know how to use the device and use the remote control, and to answer your questions. At the 2nd month mark, we may get close to curing the sleep apnea or to fully treating it, but it's important to know that we'll be tweaking along the way between that 2 month, 6 month, and 1 year mark to the point by the 1 year mark, we hope that the vast majority of the children no longer have their sleep apnea. The device itself now can be used, and it can be used each and every night. The battery, it does have a battery. The battery in the adults seems to be changed every 10 to 12 years. We don't know with children yet, because the voltage is lower, how long it will last for, but we presume somewhere between 12 to 14 years, but we're going to be in good communication about that. And it is important to know that so far those batteries are not rechargeable, so it will require an incision underneath on the breast to take the processor out and replace the battery at that period of time, 10, 12, 14 years from now. It's also important, and families know, that the actual remote device has a battery as well, and it will show you when the battery is out. Now that's easy because you just replace the battery like you would replace it for a TV remote, but it's important to know that as well. So when we talk about risks and benefits, the benefit is the ability of this device to treat obstructive sleep apnea in your child where other techniques have not been effective to date. And that's why we're having this discussion. It's important to discuss the risks itself. The risks of this procedure are as follows. Like in any surgical procedure, there's the risks of infection, bleeding, and the development of something called a hematoma, or a blood collection underneath the incisions that would need treatment. There are measures we take to avoid this, and we use antibiotics during and after to avoid infection, but it's really important that we work together on that. A lot of parents ask about what the risk is to the actual hypoglossal nerve, which is the nerve that moves your tongue, and will the children have difficulty with swallowing or speech afterwards? We haven't seen that to date, but that surely is a risk. I think it's a very, very small risk, but it's important to know about. Interestingly, it may turn out that one of the benefits is not that the children have difficulty speaking, but as the device is turned on, night by night by night, many of the parents are reporting to us that their children's speech is improving during the day, almost as a biofeedback, as the muscle itself the nerve has been activated and the muscles have begun to work more and more and more. So I think there's a blend between risk and benefit here. There is a risk because we're operating near the facial nerve, or the nerve that moves your lower lip. And we take a lot of time and effort to avoid this, and to date, thank goodness, we've not had that happen. But it is possible that there's a transient weakness of the lower lip that should resolve within a month or so, but it's important to know that. Finally, the other risks that it's important just to cover is that, like with any surgery, that there's a risk that it doesn't do what it accomplishes to do. These are early days in hypoglossal nerve implantation, and so far the vast majority of these kids come out and they no longer have sleep apnea to any severe degree. But there is the risk that in the end your child still has sleep apnea, and there may be other measures that need to be taken in order to help your child. This may wind up being monotherapy, as it's the only thing, but there may be other measures such as oxygen, more surgeries, different techniques that need down the line that need to be done. So we'll continue to work together with you on this. With regards to MRI compatibility, this will change over time, but right now, with the latest iteration of this device, you can have an MRI of your head, your lower extremities and your arms, but not your stomach and your chest after. So it's important, and we'll talk about this beforehand, that if your child, for any reason, needs cardiac MRIs, for example, this would not be the appropriate surgery for your child. Finally, explantation. Some parents have asked, would the device ever need to be removed? And so far we have not needed to have the device removed, but in the case of some form of trauma or for events that we probably couldn't foresee, if the question is, could the device be removed? The answer is yes, that would be a surgery, but the device could be removed. In the adult experience, for those adults who have decided not to use the device, they've just left the device in and not gone through the surgery to remove it. But once again, because some parents do ask this question, the device can be removed. With regards to informed consent and asking and answering all of your questions, I think it's also really important to know that there are a lot of other families who have been through this, and they're a really important part of the informed consent process that we feel or suggest that you consider is talking to other parents whose children have gone through this procedure. And in fact, one of the mothers of the children who have undergone this procedure has created her own Facebook page to put the parents in communication with each other, both for questions preoperatively and questions perioperatively and postoperatively. What is a sleep study? What happens then? How do I get to Boston? How do I get elsewhere? What do I do when I get there? What is the surgery like? What are the first few days like? Parents talking to parents adds so much richness to the informed consent that what we go through here is just a beginning. So I can't stress that enough, that if you feel comfortable, we can provide the means for you to talk to other families. So I hope this video has been helpful for you, both to understand what the actual surgery is, what the hypoglossal nerve stimulator is and what it does and how it could help your child, what the actual surgery entails, and what that 1-year process and the continuous interaction and communication will look like. You're going to have many more questions after this video, and I hope that we can point you to the resources, both online, through articles, and through talking to other families to gain more information. But please feel free to reach out if you have more questions or you want to learn more about the surgery itself.